The next company to speak to us is Aspen Laser. Aspen Laser was founded in 2014 and is headquartered in Lindon, Utah. Aspen Laser is primarily focused on developing non-invasive photomedicine technology. The company has grown to become a worldwide leader with over 1,000 customers around the globe. Aspen Laser is currently FDA registered and holds 2 FDA 510 clearances. Additionally, the company has achieved a number of ISO certifications, and Aspen Laser was the first Class 4 laser named as Space Certification Partner. Here to introduce us to Aspen Laser is Valerie Krossin, who is the Educational Director of Aspen Laser. She has over 2 decades of experience in nursing and photobiomodulation. She has emerged as a leading expert in the field, and she's spoken to us before and does a very good job of explaining Aspen Laser to us. So welcome, Valerie.
Thank you. Good morning.
Good morning. So maybe you can just give us a nice overview of Aspen Laser, what the product is and what the technology behind the product is.
Absolutely. So Aspen Laser is a company that develops and manufactures Class 4 photomedicine devices. So photomedicine, by definition, is the application of very specific colors of light to tissues that are sick, degenerating, or at risk of dying to stimulate a repair process within those cells. It's very specific to the math and physics of light, so it's a very complex technology, but when applied properly is quite profound in many ways. And so Class 4 laser is one of the delivery system, and it's a way to deliver light to local targets with significant amounts, and to get the deepest penetration possible. When you do that, our FDA clearances are around in the historic use for Class 4 lasers, which I'll come back to the history in a moment. The historic use for Class 4 lasers is aches and pains in creaky joints. So you can apply our device, which is a quad wave, which means we have 4 colors and up to 47 available watts of energy at one time, delivered through a handpiece that's about 3 centimeters across, which seems like a great deal of energy. But if you can see by the screen, that's a good example of how it's applied directly to the skin. When that light is transmitted into the tissue and scatters in every direction, it's absorbed by every cell that it reaches at the intensity that it's delivered in. Intensity determines tissue response. So low intensity stimulates repair, moderate intensity can slightly inhibit or downregulate cells, and too high intensity can be thermal. We are not talking about thermal here at all. We use low intensity to stimulate tissues, reduce inflammation, increase the circulation, and activate a healing process within the cell wherever it's absorbed. And the reason I say that is because even though our clearances are for circulation and inflammation and arthritis and pain, it literally works in every cell exactly the same way. It works in the energy production cycle of the cell, removing a roadblock that keeps the cells from breathing properly. And when that roadblock is gone, it's a particular molecule, it displaces it and gets it gone. And when it's eliminated, then the cells start to breathe better, make more energy, and the healing occurs because the roadblock is gone. And so the first mechanism is absorption. The second is increased energy production. The third is increased circulation. The fourth is reduction in circulation. And then the downstream cascade is cell specific. So if I'm treating a low back, for example, my goal is pain management. I'm going to use a higher setting because my target's deeper, and I'm going to deliver over a treatment area that's appropriate. For how long? Until it feels better. It's almost that simple. I can reduce pain in 95% of the conditions that I'm put in front of in 10 minutes or less by about 75 to 80% and oftentimes 100%. Now, the first time it doesn't last very long. It may last 2 hours or 2 days. I don't know, and it doesn't really matter. The first treatment is to identify if this client is a good target, a good candidate for the therapy, because if they respond positively in that 10-minute session, and if I can treat them every other day for 6 to 10 sessions, it becomes long-term sustaining outcomes. Now, if there's an underlying mechanical dysfunction like a disc issue or severe arthritis, etc., that pain will eventually start to come back, and that could be in 2 months or 2 years. It just depends on human variables, the uniqueness of the individual. But once we get it under control with 6 to 10 sessions, which is done over the course of 2 to 3 weeks, it becomes very sustaining pain relief. And then it's just an as needed thereafter. So that's the pain side. That's our first clearance. The other clearance is actually for toenail fungus, which is very interesting because toenail fungus we treat with the thermal side I mentioned to you. We turn the light up to such a degree that it becomes very hot and it basically kills the fungus. And then the toenail grows out clean and healthy over the course of the next 5 to 6 weeks. You treat it 3 times over the course of the first week and it's done. It's over. It works brilliantly. And then the third application is the one I mentioned, we slightly inhibit cells. When we slightly inhibit cells, nerve cells specifically, we can do a temporary Band-Aid approach of pain relief. So when we treat for pain in the low back, the reason I said it doesn't last very long the first time is we've inhibited the nerve fibers, the alpha and C fibers, but the stimulation component that I mentioned earlier goes at the deeper level and continues to heal over the course of that 2 to 3 weeks, thereby the sustaining outcome. So those are the primary uses of photobiomodulation in a class 4 laser historically. The newest application, which we do not yet have FDA clearance, but there is a path to market on it, is application for cognitive health. When you can put enough light into the tissue, especially the brain tissue, there's actually more receptor sites for in the brain than any other part of the body for these colors of light. What light does in the brain is actually, as I mentioned, quite profound. It can do things like enhance cognitive function, improve memory in healthy adults. But when you get people that are not healthy, it actually, again, stimulates a repair process, increases blood flow to the brain, tissue oxygenation, reduces what's called neuroinflammation, increases a thing called BDNF, which is a transcription factor that improves the connections between the nerve cells. It's called synaptogenesis and stimulates healing within the brain itself. The benefits last, or the treatment course is 10 to 20 sessions over the course of 5 to 10 weeks because it's twice a week therapy. And the benefits last literally years beyond completion of the therapy. Really quickly, actually, I should have pulled it up and I didn't. I'm going to take a moment to pull up an email and show you another visual. We have a doctor that's recently been doing some pre-QEEG testing with me, QEEG and pre and post therapy. He does, when an individual has a traumatic brain injury or concussion injury, the mainstream medicine, gets them through that initial injury and basically says your deficit is what it is. Here are the things that you can do in regards to physical rehabilitation to manage your life. But there's not much we can do for your TBI and concussion. Whereas now we're showing with lasers, again, the benefits are quite profound. Not only profound, but again, last for years and years. We have a MD PhD in Colorado that's been using our laser for cognitive health for pushing 8 to 9 years now, and he's been tracking his clients for years and years with these kinds of benefits. He uses a test called a SPECT scan. SPECT scans are pretty expensive to get there. It's a bit of radiation. We are also discovering that with QEEGs, we can measure electrical activity before and see the benefit to the laser much more quickly with the QEEGs, and it's a very non-invasive test, so it's easy to track people and track outcomes. So what I'm going to pull up for you guys is a recent work that Dr. DeBrinket did for us regarding our laser pre and post, and to give it a little bit of a foundation. He has been doing what's called neurofeedback training for about 30 years. So again, when people have concussion injuries or traumatic brain injuries or any type of brain issues, neurofeedback training is one of the few interventions that actually helps bring a person to better cognitive function. It takes weeks and months for the therapies to be beneficial. They're quite exhausting for the client. They're effective, but to about 50, well, I'm not going to make comparisons. They're basically the standard of care right now in for people trying to get improved cognitive health. Let me see if I can figure out how to unshare this screen and reshare the next one. Give me one moment to switch this back. There we go. I'm going to share it to a different screen because this is a study that Dr. DeBrinket did for us to lay the foundation. He tested over 80, did over 80 Aspen treatments. This is a group of individuals. All the data is collated into one general report here. So the baseline, the mean is the baseline. So there are 1, 2, 3, 4, 5, 6 different categories, if you will. The first category is addictive tendency. The first, the image on the left is the baseline pre-treatment, and the image on the left is post 12 sessions with the lasers. So 6 weeks of therapy. Remember, I said it's a 10 to 20 week protocol. So you can see the first one. To give you an idea of what you're looking at on the left-hand side, if there's no line, it indicates normal function. The red line shows an overactive connection in the brain, and the blue line shows underactive connections. So you can see the number of lines is quite significant compared to the post, the elimination of those lines, which remember, no line is actually normal. The other thing is there's what they call broad-main areas. There's 52 broad-main areas in the brain. So different parts of the brain that manage different types of activities. These are all of the Brodmann areas that improved over the course of 12 weeks. There wasn't a single one that did not improve over the course of 12 weeks, or excuse me, 12 sessions. This is one for anxiety. And as you are aware, anxiety is extremely prevalent in the world today, but very significant pre and post on that as well. And those Brodmann areas improved as well. This one's on depression, very significant. The next one is on working memory. One of the things I hear most often is how quickly people's memory improves, even after 1 or 2 sessions. And then cognitive protocol there for attention deficit disorder. And then the last one is with ventral attention, so just focus. So one of the things that's laser has been well documented. There's actually multiple published studies from our practitioners that use our devices specifically for cognitive health, is increase in all of the motor function, or sorry, all of the memory, depression, anxiety, ADD, PTSD, suicidal, all these things are getting better with light, and there are absolutely no side effects, and specifically no negative side effects to the use of light in the brain. There's a great deal of research on PubMed on both lasers and LED devices. The differences is it's a what you call a challenge of scale. You can't get enough light directly to the brain with LED devices. It takes actually 13 watts of light to get enough light to get about 9% through the skull and the tissue to actually reach the brain. And that's where the benefit starts to happen. So if there are LED devices out there in the form of hats and helmets, etc. But when you stop using that device, the benefit disappears. There's actually more and more work starting to show on things even like Alzheimer's and Parkinson's as well. So this is the newest and most emerging and frankly, the most exciting application for photobiomodulation. And again, by definition, the application of light to tissue that are sick, degenerating, and at risk of dying, and it stimulates a cellular healing process specific to the tissue itself, simply by removing the roadblocks, allowing the cells to breathe, make more energy, reduce inflammation, and just thereby heal. So it's a very complex math formula, basically.
Okay,
so that's the overview. And that was
a nice overview. Very, very thorough overview. So are all of the products you're talking about today, are they all practitioner administered or any
Yes.
patient administered?
So the last week's presentation was on the full body devices, which are LED based. Lasers by definition are class 4 lasers, and specifically are medical devices. So under the supervision of trained medical professionals. So if a health professional wanted to purchase a laser for their practice and use it for aches and pains and creaky joints and the toenail fungus, because those are FDA cleared, we just go straight to teaching them how to do that. They can delegate that to their technicians because the doctors are already very, very busy. So every state, the FDA says that it's a practice of medicine. The doctor has to be a medical director that oversees the care, but can delegate it to the technician based on the state's regulations. And then basically, frankly, it's in almost anybody they decide to use it. It's whether they have to be in the building or not is the differentiation. When it comes to brain application, the doctor, it's an off-label use, so the doctor has to have the scope of practice to say, yes, I have the scope to work on brains, therefore this is going to be a tool in my toolkit. And then again, they can delegate it if they choose to, but most often the doctors do the therapies themselves, even though it's completely non-invasive and very simple to apply.
Okay. And then another question is, you're talking about the application of energy to cells. Do your products have a positive, negative, or neutral effect if the cells are cancerous? And then
Ah,
second question similar to that is, does it have any impact on fat? Fatty cells, does it burn any fat while it's
that's two
doing
great
things?
questions. So I'll take the first one first. I get the question every single time I'm training. It's part of our training program. Cancer, the recommendation regarding cancer is to not treat over a known cancerous lesion. However, in the systematic review of the literature, there has been no increased incidence of cancer in folks that have been candidates or used therapy than folks that have not. There's actually several position papers by the top researchers in the industry suggesting that in the not so distant future, we will be using the very low intensity light sources as potentially a intervention, because the way that cancer works, because it replicates very quickly, it uses up the local oxygen very quickly. It has the ability to use free radicals as a secondary source of energy. Light gets rid of free radicals. So that's one of the ways. It also supports immune function, which is why I have actually an oncologist that purchased our full body LED system for her practice. And what she does is has the clients use the technology prior to their cancer therapies and between courses of care. You can't do it during the cancer therapies because antioxidants actually reduce the benefit of the medications, but you can do between courses and afterwards to keep their immune system strong so the cancer doesn't recur, because oftentimes the cancer therapies are damaging to the immune system as well. So we recommend that they not use lasers directly over a known cancerous lesion. And if they've been within 5 years of a clear, if they've gone through their cancer care and they're in remission, we ask that the oncologist weigh in and give approval to use the laser if they want to use it prior to moving forward. So for example, if somebody has bone cancer and they have low back pain, we don't want to treat over that low back pain because we don't know if there's without the oncologist's permission, but we could treat over, shoulder muscle pit without having to get permission. It's a different area. It's not the cancerous area.
So if somebody had radiation treatment in one area, you would just recommend not treating that one area, but treat other
Correct.
areas.
Unless it's something like bone cancer, which can metastasize into other areas, or so it's some cancers that can metastasize into bone cancer, because bone cancer is very painful. But most of the time, oncologists will allow us to do it for palliative care anyway. So the rule of thumb is don't treat over known cancer unless the oncologist gives us permission, basically.
Okay. And then the impact on fatty cells.
So there is a market right now where people are speaking to red light therapy for fat loss, specific to fat loss. So it's again, light is physics based. So the intensity determines tissue response and the colors determine where it's absorbed and what it does when it gets there. So the devices that are being promoted for fat loss are mild to moderately effective, truthfully, because it takes very high intensity. It has to be super close to the tissue itself. And they call it body contouring. And the wraps that are out there are the most effective, but they're very professional. The practice is very employee heavy. Time-wise, it takes a long time to put them into these wraps and a long time to take them back out. They're decently effective though, enough that people like the results and continue to use them.
Okay. And then do the products you're talking about today, is there a synergy with the product you spoke to us last week, the bed?
Yes.
So if I'm getting treatment with a practitioner, does he take into account the treatment that I'm giving myself at home?
Well, so the full body device can be is most often about 50% of the time go into practices and 50% of the time go to the home, but it's not a medical device, so anybody can own and operate them or have a business around them, the big beds. But it's interesting when I'm training a practice on the lasers, and what they do is they line up a whole day's worth of clients, and we treat as many different variation conditions as possible: shoulders, hips, knees, all of those things. And almost about every time, by the second or third client in, we have a client that says, "I wish you had a whole body one of these because I hurt everywhere." And then we joke and say, as a matter of fact, we do. So again, light from a class 4 laser is designed for spot application over a single area. The full body is whole body systemic reduction of inflammation, which reduces pain as a side effect, if you will. And so they can be used very synergistically in a practice together, and oftentimes are. So after the laser, the practitioner pops them into the light bed to manage the systemic inflammation, and then out the door they go.
Okay, so we have some pain practice managers here. I think their questions are, how much do these different devices cost? What kind of financing is available? What kind of returns on investment do some of
Yes,
your
great.
practitioners see?
So the class 4 lasers range from 36,000 to 48,000. We have two primary models. The return, and that's typically financed over 5 years and as an average. So your average payment is between $700 and $900 a month. The return on investment is actually very strong because we recommend $75 for a single session, which we never do because we always do a package of 6 or 10. But the first session is usually free, and that converts them very quickly into a package of 6 or 10 because it works so significantly. They're not, even if they didn't know it existed before, they now know that it works for sure. So it converts them into a package of 6 to 10. 6 is $60 each, 10 is $50 each. So typically they buy the package of 10, which is $500. So it's $50 per session. You can do 4 sessions per hour because our treatment time is 12 minutes or less. And so that becomes a $200 an hour revenue generator. So if you're using your device 2 hours a month, you've covered your costs, 4 hours a month, you've covered your costs. Most of my practices tell me that they pay for the equipment pays for itself, including labor cost in the first 3.5 to 4 months. And thereafter it's a revenue generator. And it's basically a $200 an hour revenue generator because most of my practices say it turns on in the beginning of the day when they get there and turns off at the end of the day when they turn off. They hire a dedicated staff for the laser and it runs all day, every day. Now in practices, that's chiropractic practices. Physical therapy practices, they tend to spend more time with their clients. They usually spend about 45 minutes. So that laser then rotates between 3 to 4 practitioners and again is on all day, every day. If it's a small practice, whether it's a single practitioner, then we recommend the smaller device, which is the one that says 36,000, because it takes a little bit longer for the therapy, but you're not able to do 4 sessions an hour typically because it's a smaller practice. So we're looking between 50 and $50 and $200 an hour revenue generator.
Okay. Is there any risk
every day?
to overheating or
No, they're actually quite a large model. The 47 watt has a big housing, and it's because we have very large fans in it to keep the diodes cool, because the number one failure point to a laser is heat. And so as long as those fans are running, you can run it all day, every day. And we have a 5-year bumper to bumper warranty. If anything goes wrong, we'll replace it while yours is getting fixed, and then we'll trade you back so that way you're not out of business. And then, but these devices, I mean, I have clients that when I came on board with the company in 2018, I had clients that were calling and I was doing support on that had their lasers 10 years of practice. So they're designed for the long haul, but we do a 5-year warranty on them, bumper to bumper.
Okay, and just another question. It's applied directly to the skin, right? And are there any preps? Do you recommend the patient be hydrated or
That's a
eat or
great
not
question
eat
as well.
before?
So hydration, water is actually an absorption of light. So if a client is well hydrated, the laser actually works better for those folks versus those that are dehydrated. Dehydrated skin actually reflects light more than hydrated skin as well. So hydration is an important piece, but there's no, other than that, wearing loose fitting clothing is the only preparation for a client to come in the door. We do have, and we're just about to release a patented formula. It's a topical solution. It's called a clearing agent, a topical clearing agent. It makes the stratus corneum, which is the skin basically, nearly see-through to light. So light goes through much easier. We're going to get about 30% more light to the target. So we're going to have faster. I've been using it myself now for about 6 months in a beta test. We see significantly faster results than even without, and I was thrilled before. So what's nice about that is now the doctor actually has a little bit of a consumable as well if they want to do that, but in the light bed side, because if you put it on like the tanning bed industry and like a tanning gel, it's a consumable product so that they can sell the product as well as the light itself.
Yeah, so I was going to ask about the razor blades. So the razor blades are what did you have?
No, not razor blades.
No, I know, but the expression. So the consumables
Oh, the
consumables
consumable.
that you sell?
On the light bed, we have a consumable and a topical. On the laser, there's no consumable. The doctor uses it to increase performance, but it's not something that they charge the client for. It literally takes about two mLs is all to make that work better.
Okay. Kind of bouncing back and forth between business and science, but are there any drugs, or does the doctor have to check a list of drugs the patient may be
There are no
taking?
contraindications. The only contraindications with light are direct viewing because the eyes can focus light 100,000 times smaller, so it can potentially burn the back of the eye. So everybody within 11 feet wears goggles that are specifically rated for the colors of light that emits. Photosensitizing medications can be a concern. In 16 years in this industry, I've never seen a single photosensitizing reaction to skin. I've heard of it with a particular medication that people that have lupus take. So we always ask the question. I've had a person raise their hand and say, I take a medication, and she opted out of the therapy. What it does is blanch the skin and the color doesn't return. So it is definitely something you ask the question of. But again, in 16 years of doing this full time, I've never personally seen it. So it's very low. Seizure disorders, anything that's a flashing bright light, we have to ask if they have a seizure disorder as a precaution. We don't treat over known cancerous lesions, as we mentioned. We also don't treat over a recent injection site. 2 to 3 days after any type of injection, we leave that site alone because there could be a photochemical response with that medication as well. So that's just a precaution. I've seen that increased discomfort in a client after they've had a steroid injection for low back pain or hip pain. And so we just leave the area away. It's not that it hurts anything or damages anything. It just increases discomfort.
Okay.
That's about it. That's about all the
Okay.
contraindications. We can treat over pins, metals, plates. It doesn't warm anything up. The warmest the light is at the surface of the skin. It's very tactile. It's warm. It feels like a warm stone massage. So it's an incredibly pleasant procedure as well.
Okay. Are your products applicable for toothaches?
I have actually a great number of dentists that use lasers. You can pre-treat. I've actually had a total crown done without anesthesia using laser as a numbing agent. You just shine the light on it on the stronger setting. So yes, it will down-regulate the pain by desensitizing the nerve. It's not healing that tooth. It still needs to have dental work. But that's not generally what they use it for. Most of the time the dentists use it preventatively. They pre-treat, do the work that they do, which disrupts the tissue, and then post-treat, and their healing is 30 to 40% faster with light than without, especially things like bone implants. It significantly increases the rate of that bone implant taking, and so they have less redos when they use light as part of that process.
Okay. So how long have these products been on the market?
So the first laser was actually discovered in 1960. First photobiomodulation was 67. They went to market shortly thereafter, but we didn't understand the physics of light, and so the results were all over the map. It wasn't until probably, well, Charles, our CEO and founder, has been in the industry for 35 years. I've been in the industry for 16. So over 30 years, these products have been around. But in 2014 is when the engineers figured out the math and physics of light as it related to dosing. And now we can calculate dosing based on depth of target. And so we have very specific dosing formulas now. And so we have very predictable outcomes. So it's since 2014 and forward, the outcomes are dramatically better. The unfortunate thing is that the insurance companies said no to reimbursement prior to that, and they won't review it. There is reimbursement for cancer therapy side effects, oral mucositis, radiation dermatitis, things like that, because it's so profound in an area where nothing else works. If you are going to have head and neck cancer radiation, that they're going to put you on a feeding tube at day 17. It's just part of the process because you have so many open sores in your mouth that you literally can't swallow and drink, and they don't want to continue their therapies. Oftentimes they stop their therapies because it's just too painful. But if you pre-treat with light and treat concurrently, there's almost no eruption of those sores. So that's the one thing that is covered by insurance. It's called oral cancer therapy side effects. It's brilliant. It's actually profound.
Yeah, that's a very good point, bringing up the coverage.
I think we're going to see more and more coverage on insurance. There's actually a T code now, which is a temporary code. It was set to expire in January of this year, and they've extended it for 5 more years. So I think we're going to see reimbursement because because lasers weren't, we didn't understand the math. They weren't as good back, even early 10 years ago. Now they're so predictable and so significant, and they work for so many things that it's almost embarrassing that they don't cover it, frankly.
Okay. So maybe just two more quick questions. How much electricity do these devices use? We hear about higher electricity prices.
You won't see a change in your electrical bill.
Okay.
LEDs and lasers are very efficient devices.
Okay. And then last question, are there examples of clients that have bought multiple units, started with one, and then were happy with the devices and bought more?
Yes.
Products?
Yeah,
Okay.
I have, well, franchise models. On our Lightbed side, there's franchise model that it's a mandatory piece of their equipment. And so we have one location, one franchise that has over 50 units in their franchise model. They have 50 locations. I am working right now, and I can't get to it with a client that's intending to open 1,000 locations. That's his goal over the next 10 years. Yeah, he's a spinal surgeon, which is fabulous. Think of that. A spinal
Yeah.
surgeon, there's gaps between when the people walk through the door and say, I have this terrible pain. He says, you're not ready for surgery yet. So now we have a place they can go and get therapy. And he's actually partnered
Okay.
with a world-renowned neurosurgeon as well, and on the cognitive side. So it's pretty exciting stuff.
Yeah, it does seem exciting. Any final points you'd like to make?
Here's the barrier to, there's a couple barriers to market. Number one, it seems too good to be true. How does light do all of these things? So what I've learned is I go and do a demonstration. I'll tell a doctor, you could read the literature. There's over 50,000 published studies. But most often it just seems too good to be true. So I'll say, let me come in and do a 3-hour demonstration. I do a demonstration and I have a 95% close rate because they're more than willing to buy a product that works. And there's just no question at the end of 3 hours working on every type of, they always bring me their most challenging children, by the way. And so we just hit it out the park. And that's the way to, so I'm looking forward to the day that people just accept that it is what it is, and so I don't have to go do the demos every day, but it's still a super fun part of my job. So I do that, and then I go back and formally train the staff to administer the therapy.
Well, Valerie Krossin, thank you so much for speaking to us. As always, very interesting presentation on Aspen Laser. It sounds like a very interesting line of products and a great company, a great story, and you presented very well on behalf
Thank
of
you.
Aspen Laser.
I
So we really
appreciate it.
appreciate that.
It should be in every medical practice, frankly. There's not a practice it doesn't apply to. So
Well, it seems like you're doing a good job
thank
trying to
you.
make that happen.
Appreciate it. You have the
okay.
best day. And again, forgive me for my tardiness this morning.
No problem. Okay, so we'll end this session here. Thank you, Valerie.
Bye.
Okay. All right, so let's take a break for just 2 or 3 minutes, and then we'll come back and listen to Mind Lab.